Hi, this is Dr. Brueck coming to you once again with some of our basic series on intro to cosmetic surgery procedures. At this time I'd like to talk a little bit about breast augmentation. I have to say this is probably one of the more common procedures that we do, and has one of the highest satisfaction rates. And again, if you want to schedule a complimentary consultation, you go on to our website, Beauty by Brueck, and there's a link there where you can set it up online and email me, or you can call our office at 239-244-2329. Again, 239-244-2329. What is a breast augmentation? I think it's pretty self-explanatory. You're taking the breast, you're augmenting it. Now basically there are two types of implants. There's a silicone implant and a saline. And I don't think there's any question that a silicone implant is far preferable. If I never did a saline implant again, I think I would be very thrilled and very happy. So I always try to steer my patients into a silicone implant. It's a little more expensive in the initial stages, but in the long-term analysis, they're very durable. I've had some women that have had them in 30 years. So it really is the way to go. It's the Cadillac, if you will, of breast augmentation. The whole purpose behind the breast augmentation is to enhance the fullness. Now most women after pregnancy, and as we age, our breast loses volume. And after pregnancy, we develop a certain amount of sagging or ptosis. And we'll talk about breast lifting a little bit later, but sometimes women come in there and they say, you know, my breast looks kind of tired. And what's happened is the volume of breast tissue has diminished relative to the amount of skin that they have. And the net result is that the breast does look kind of tired. So I generally will make an inframammary incision, which is below the breast, and I will develop a pocket in one of two planes, either above the muscle or below the muscle. And which plane we choose depends on what the physical exam of the patient shows. Depends on what the patient wants. And I think one of the overriding concerns with breast augmentation is that people understand that there's only so much you can put into chest cavity or hemithorax. I always tell my patients you can't take a gallon of milk and put it into a quart container. It always amazes me when a young lady will come in or a woman will come in and say, well, my neighbor had 550 cc implants put in, I like it and I want it, and they're 4'11", weighed 90 pounds, and there's no way you can put that size implant into their chest. So again, that's a decision that we make jointly, and I always tell people there are several factors that come into play to decide how big an implant that we can put in. And I always tell my patients, at the end of the procedure, I always have to be able to close the incision. So it's not like you can have a breast aug and just say, well, I want 400, I want 600, I want 700. A lot depends on your physical anatomy to go ahead and determine the size. When we talk about size, I always tell my patients, I want to make you as big as I can, but so you look natural. So when people see you walking down the beach or something like that, they don't sit there and say, nice boob job, but they say, boy, she's got a cute figure. And I want you to have nice cleavage medially, and I want it to be full, because after all, that's why we're having it done. I want to be able to restore a lot of the breast tissue that was lost because of aging and also pregnancy. Now, I had a lady that came in recently who had implants put in 15, 16 years ago, and she needs to have them replaced, and they were saline. And she noticed that she started to develop rippling, and she was wondering why that was. Well, what's happened is, in the 15 years that she's had the implant hasn't changed, but what has changed is the soft tissue over the implant. She's actually lost volume. So that's a very, very common occurrence, and so I think it's important to understand that all of us will age, and part of that aging process means losing soft tissue. Now, how do we do a breast augmentation? Well, what we do preoperatively is we go ahead and we get our pictures, we get medical clearance, we usually give you prescriptions for pain pills, antibacterial soap. The procedure is done as an outpatient under sedation. So you're back there sound asleep, again, no pain, no discomfort. The operation takes about an hour and a half. I have patients bring a sports bra with them to the surgery center. That's what we put on them before they go home. And then they go home and they go to bed. What I usually tell my patients, take a Ziploc bag with some crushed ice and just kind of put it between your breasts and just lay there for the first 4 days, lay low. Again, I always have to caution people, you may feel good post-op, but that doesn't give you license to vacuum, wash windows, or do whatever. So you have to be very, very careful. As far as driving, after a few days, 4 days, if you want to do a little driving, again, I say that doesn't mean you get in a car and drive to Seattle. But if you want to drive to the local mini mart to get some milk or go to the Publix and get some bread, that's fine. But certainly minimize that because you're still early on in your post-op course. After 4 or 5 days, let comfort be your guide. So if you're washing your hair and it's a little sore, shorten your stroke, pull your arms in closer, and do your shampooing, whatever. Usually patients can take a shower a day or two after the procedure. And at that time, I have them start doing breast exercises. And the whole idea behind breast exercises is to get them to massage the breast to try and keep it soft and not get it too hard or encapsulated. After a month, you can resume normal activities, go back to the gym, do running, jumping, anything like that is fine after about a month. Stitches are buried. It's an inframammary incision. It's about 3 centimeters. And usually after about 4, 5, 6 days, you can pretty much wear any kind of bra you want. Now, what are some of the complications with a breast augmentation? Again, the usual complications of bruising, swelling, infection, bleeding, scarring. Hematoma is one. We see this occasionally in a breast aug, fortunately not a lot. And usually what happens is a patient feels really good, doesn't feel a lot of discomfort, and they get a little too active. I had one lady that was about 2.5, 3 weeks post-op, decided to go jogging and got some bleeding. So it's important to lay low and minimize the possibility of getting any bleeding post-op. The other thing people have to understand, you're going to get a capsule. Now, whenever you put a foreign body into a body, whether it's male or female, tall or short, your body will form scar tissue around that foreign body. In this case, it's a breast implant. And we call that a capsule. Now, that capsule can contract. Therefore, we call it capsular contracture. So one of the things that I have patients do post-op is to go ahead and massage the implants. And I tell patients to do it twice a day when you take a bath or a shower. So you get up in the morning, you're in the shower, you get soap and water in your chest, and you just massage that implant around to keep it soft and keep it natural. And I tell that to all the patients. You can lose nipple sensation. There can be a certain amount of asymmetry. Most women in 35 years, and I've done hundreds of breast augs, are not symmetrical. So I tell patients you're not symmetrical now, and you certainly won't be afterwards. Hopefully you will be more symmetrical, but nobody's perfectly symmetrical. But it's an awesome operation, and one that it has a high degree of satisfaction. Now, are there any special preparations? Again, we get medical clearance from your doctor. We usually give you some antibacterial soap. I'll give you something for nausea. If you're prone to nausea, we give you pain pills. I have patients bring a sports bra with them. And I want you to basically, like I said, those first 4 days lay low and avoid any kind of herbal supplements 2 weeks before surgery, anything that might preclude or cause bleeding such as ibuprofen, aspirin, things of that sort. But it's a great operation, and it's one that really is filled with a high degree of satisfaction. And again, I think it's important to understand silicone versus saline is the way to go.